Dr. Beyer, a lot of times a parent doesn't know when a child should be brought in to see a physician. In your opinion, when is a good time to bring a child in to see you?
Typically for visits for children, there are scheduled well visit appointments. Most of these are covered by insurance, and in the beginning there's lots of them. I think there's 7 of them in the first year of life. So there's usually 1-2 days after you come home from the hospital, somewhere between 2 to 4 weeks, 2 months, 4 months, 6 months, 9 months, 12 months. That's just in the first year. And then they start spacing out a little bit during the next year, 15, 18 months, 2 years, 30 months, and then it'll be yearly. And most of them are for what we call growth and development. So most of the time we're making sure your child is growing appropriately and following them on their growth curve. And then the other part is making sure they're hitting their developmental milestones. Often at those visits, parents have questions regarding, is this normal for my child to be doing, or what should my child be doing? And then some parents want to have their children immunized, so we'll take care of that at those visits. And then the other part of the visit is to anticipate what's going to be coming up in the next several months, so you kind of have a feel for what you're going to be seeing with your child. So that's the majority of the well visits. The other visits might be ill visits, and that would be more if you're feeling uncomfortable with what's going on with your child, if they have a fever, if they have a cough or a runny nose, throwing up. Typically, most of the viral processes typically are about 3 to 4 days, are kind of the worst part of things. Fever usually goes away by 3 to 4 days. If their behavior is not reassuring, or if the numbers are just scaring you, we're always happy to see your child and give you some peace of mind.